This is a very important book, and I would encourage people to pick up a copy of this. If you're a family member or a business person, this is an important book for you to understand.
This is about lifestyle change, making America healthier, empowering people to feel better about themselves through these changes. The pace of change is accelerating. So if we are not adept and open and recognizing all of the transformational changes that are occurring around us, we're going to potentially be left behind. And the same thing is happening in healthcare. I really believe that we in America and in Florida are in one of the most challenging, transformational, disruptive times in healthcare in probably 100 years plus. When David and I were writing our book, The New Health Age, The Future of Healthcare in America, we were asked over and over again by folks we were interviewing, researching, is America going to remain a great country? And our answer was, it depends. We will remain a great country if Americans get healthier, because our poor state of health right now is holding us back competitively as a nation. The wonderful thing about the New Health Age is that we are truly going to become happier, healthier, more balanced people, mind, body, spirit, as the most important benefit of the whole era. We're not in great shape with respect to our health. Nearly 1/3 of all Americans are considered clinically obese. Nearly 2/3 are considered overweight. Only about 25% of Americans regularly exercise and engage in physical activity. If you add up the total number of Americans that die each year from preventable diseases that are strictly associated with their own choices, it's about 1.5, 1.6 million Americans, almost the entire population of the city of Philadelphia, die each year from diseases that they could prevent based on their own lifestyle choices. So we're not very healthy right now. The 21st century model of the New Health Age is going to change the way we think about healthcare, the way it's delivered, and how it's paid for. On the thinking side, we're really moving from sickness to wellness. The whole model of healthcare is going to be around wellness and how to accomplish that. And then delivery is going to be towards performance and prevention. How do we prevent disease versus how do we treat sickness? And then doctors will be paid and healthcare delivery providers will be incentivized through performance and those types of things on the economic side. For American companies to compete on a new global marketplace, we can't afford to tack on $1,000 per automobile in America just to pay for health care for the workers that built that. Businesses in America are really going to be the leading driving force behind this, because we're now competing in a global marketplace, and American businesses realize that they need healthy, happy, productive employees. So what we're seeing, and we talk a lot about it in our book, is that corporate America is driving this with employee wellness programs, prevention programs, and as David said, really incentivizing and motivating their employees to get healthy and well. In the 20th century model, cancer was treated in a very regimented way. So out of the thousands of cancer patients with breast cancer, for instance, there was a regimented checklist of this is how we treat cancer. With the Genome Project that was finished several years ago, and now the mapping of the human genome and the DNA, medicine is becoming personalized on the clinical treatment side. Some other amazing advancements come with this whole personalized medicine concept, where once we are genetically mapped, let's say you have a disease like cancer, certain drugs actually work better in cancer treatment based on your DNA. So cancer doctors can actually target certain cancer treatments based on your DNA and really improve your life expectancy rate. Medical home is really going to be the core model of where healthcare is moving, to look at that prevention, look at that wellness, create that holistic experience to prevent disease from occurring in the first place. That ounce of prevention will save us so much money long term. The blame game is over. This is not the insurance company's fault. This is not the government's fault. This is not Americans' fault. The blame game is over. We've got to follow the dollars. And ultimately, the dollars are all of us in the room. Taxpayers, employees, we are ultimately the ones that are paying the cost for health care. So what's going to drive this change is ultimately employers, employees, then followed by the government, putting in place steps and mechanisms to change lifestyle, which will bring down the cost.
Endorsed by Dr. Oz and by two gentlemen here who have really put in a lot of work and effort, and a lot of love goes into this book too. I mean, you can tell that there's just a great deal of information that's really relevant for this nation.
I don't think you have enough information in this book by any means.
It's certainly encouraging.
Yes, it is.
It's actually, the future is looking really good. Jonathan Fleece and David Houle, thank you both very much.
Thank you.
And again, the book is called The New Health Age, and you can get it where books are sold.